might as well get right into it. So
Yeah.
go ahead and what do you want to talk about?
I want to talk about the foot. I feel like I've been like at least following some Bill stuff and like hearing about like he's been talking about relative motion at the foot and what should be happening in the gait cycle of that. And I think I just don't totally understand what should be happening from that perspective. Like I think I understand more further up the chain and closer to the axial skeleton what's happening there, but as you get more distal, that's where I sort of get confused. And I'd love to go through just first, what should happen normally through the gait cycle if you have full access to breathing excursion.
Sure. So let's think about a couple of like broad rules. Like first, like you think about like supination, pronation. Like the outside of the foot would generally be more supination, and that's important to think about because as you start going through the gait cycle, like certain things might look like plantar flexion and then therefore supination, but they might actually be moving towards pronation, right? So if we think about like moving from outside to inside of the foot as supination to pronation, that's helpful for me to think, all right, am I moving more towards pronation or am I moving more towards supination? So when we think about the gait cycle, like the initial heel strike is going to be outside of heel, like lateral heel. So if we can think of it like that would be supination, even though the toes are pulled up and it looks like dorsiflexion, right?
Yep.
And so then we have to think about, with gait, like what foot is taking more weight as well, right? And that there's this sort of reciprocal relationship, which can be confusing. So it's helpful to just think of like one side at a time. So to start, just having the idea of like, what do we want optimally to happen at the foot during one step, right? So you've been in the clinic when I do like slow walking with people.
Yeah.
And like, I think that's like a really good way to start to train like the sensation of what you want to be able to do and then what you also can't do. So a lot of people just like, they won't be able to feel it, or you can see pretty well that they're just not going to be able to make all the contact points that you want them to make. But ideally you want to go like outer heel and kind of ride towards the outer part of the foot. But as you're riding the outer part of the foot, like the foot is flattening out. So that's where like pronation comes into play. So as you get yourself to like that mid stance position where your tibia would be stacked over your ankle, you're going to be in much more pronation. So pronation would start to look like a little bit more calcaneus. You started with the outer part of the calcaneus in contact. That would be more of an inverted calcaneus. And then as you're starting to get more towards like that propulsion or mid-stance, it's going to become more of an everted calcaneus. It's all relative, right? Moving into that direction. Like, so you don't want the typical pronation that we think about as like a collapsed foot. That's too far.
Right.
And when you think about that foot, like that navicular kind of being on the ground, that doesn't indicate that foot pronates well. It just means like it's just looking for stability by just being on, like the inside of the foot's looking for stability by being on the ground. But it doesn't pronate or supinate well. It's just
right.
You know what I mean? So it's not like it's good at pronation and we need to give it more supination. It doesn't do either well. So that becomes like it's like a starting point that it won't be able to go through the gait cycle like we're talking about either, right? So that ankle also doesn't pronate well, even though it's already like in pronation.
Okay, yeah.
Right. So, but just that's sort of like a digression, but just to kind of get the idea of some of the terms you might hear around pronation and how they might not fit with the way that it's being talked about, like optimally during gait. Because you're just relatively moving, again, more from where you started, more outer heel, and then coming more toward, like, you can think of a flatter foot, but you also have to think about, like, the relationship between the tibia as your body's moving forward. So when you get that initial heel strike, your tibia is going to be angled and such, like your trunk is behind your leg, right? And then as you're getting more to that mid stance, the tibia is going to be more over the ankle. So then you need that callus also to be able to like move relatively forward over the calcaneus.
Mm-hmm.
All right. So that will be, you're getting more relative pronation. So a lot of the videos I've seen that Bill's doing, he's trying to restore that area there, that mid stance or that like mid propulsive phase, where you want pronation for propulsion.
Right.
So we need to make sure that like you're either not going too early with propulsion, which would look like is you may just never get to that outer heel. That's very common. Like that initial heel strike is already like medial on the foot.
Okay, yeah.
And then you just sort of like bypass, like you hadn't gotten to supination, you hadn't been able to expand. So now you're not going through the kind of normal mechanics, and that makes your pronation not as effective. Your propulsion not as effective because you didn't get the original like supination expansion to get to the outer heel, so that you can start to come across the foot. So that could be something that needs to be worked on. You think about that might be like we need to get somebody, if it's like a left side, to expand back. Heels elevated, make them feel outer heel. You need to be able to expand, but then we might start to, if that can happen, then you start to work the tibia over the ankle while keeping more medial heel contact, right?
And that would be like mid stance.
Now you're going towards mid stance. You're going towards that mid propulsive phase. So there's a huge subtlety here. So I think like a really practical way to think about it is medial heel, but you don't want valgus at the knee. Like you don't want an extreme amount of valgus. Like you want to feel like you're on the inside of the foot, but you want that knee to be able to just kind of go right over the big toe, right? Like you don't want it to drift in, and that's where the control comes in. So that's sort of like a good drill that you can think of for that phase. A lot of times now during gait, you won't have to have your tibia go that far forward. You're just sort of trying to get to the point where it's kind of stacked over the foot. And then as the heel comes off, that's sort of the max propulsive phase. And the other way that I'd like to think of this is it's when your body starts to fall into the next step, right? Because you're now going in front of the line of gravity. So like in the pose running methodology, it's all about gravity and falling, and then just being on top of the pulling yourself into the next stride or the next step. So if you think about it from that perspective, wherever you start to fall would be like the max propulsion, because that's when you're starting to move. And then like gravity takes over. Like you're not doing the propulsing, you're just trying to coordinate your next steps so you don't fall on your face, right? And you're trying to make that as efficient as possible. But like when you start to fall would be when you would be propelling the most. Right? So that would be like heel with gait, that would be like heel off. Right? And then that's where but that would be like when the tibia is starting to, it's vertical, and then it's starting to kind of get a little bit past that. But then immediately you start to go into that, like you're now heavier on the other leg. Right? So then it becomes like that's the shifting in gait, shifting to the other side. So you've propelled, and now you're starting to move into and load the other side.
And then so if you take it further and look at it in running, like since you're moving faster, are you pretty much just like, does that early propulsive phase, like supination, does that get minimized since you're not necessarily on the ground as long in a sense? Like, I guess I'm thinking if you're like sprinting, like, are you pretty much just propulsive the second you hit the ground? Because you're just
I mean, like the faster you go, the more time in propulsion, the less time in loading.
Yeah.
Right.
Okay. Makes
and
sense.
or like the more you're kind of in mid propulsion. So the other way that I like to think about this, and I think we've talked about this before, is like rotation. Like the more you rotate and alternate, the longer your stride is oftentimes, because that rotation allows for a longer stride without a complete like loss of posture, right? Because it gives you like an extra plane of motion, right? So if you're just moving straight forward sagittally, if you were to take a long stride there without any rotation, you would have to be real heavy into the ground. Like it wouldn't be able to be very coordinated. But in order to take a longer stride, you need more rotation, right? But when you sprint, like if you want to get from point A to point B quicker, you're going to start to lose a little bit of that rotation. So someone like jogging versus sprinting, there'll be more of an alternation in jogging. So then there would be more of this kind of expansion to compression, like a greater spectrum of that than directing things in one plane, right? So, and I think a lot of times the cueing might be more propulsive when you go faster. Like I know it is for me, and you still got to let go a little. You know what I mean? Like, and everybody's got their like when you assess someone, you see like, or maybe they're like going a little too propulsive, right? Like their stride's too tight, and they need to like be able to open it up a little bit. But relative to something that would be like sprinting versus walking, there's definitely going to be more alternation, reciprocal motion. So when you sprint, you're going to start bringing things to the middle, is the way I like to think about it, and you're going to be concentric, so you're going to be more propulsive.
Yeah, and obviously, like you said, it's a spectrum still, because I feel like I hear sprint coaches talk about like they want their athletes to be relaxed and not running with like high tension. So I guess it's just such a, I don't know, steep slope.
Absolutely, like you need to have both. It's just when we're talking, it depends on like what you're comparing it to. If you're comparing it to someone who's got like a real tight sprint and you want the sprint to open up a little bit and be more relaxed, then yeah, they need less propulsion.
Yeah.
But if you're comparing it to walking or jogging, it'll be more propulsive every time.
It's like you basically just almost need them to be expansive enough to like hit positions they need to hit, and then
exactly, yeah. Right.
Okay.
And you know, there's this relationship to stride and efficiency, right? Like I still like to think of it as going with the fall in the most efficient way possible, right? And that, like I've seen Usain Bolt's sprint broken down, at least from the pose mechanics.
Yeah.
And you know, the one thing that they say, or that you know they have statistically indicated, is that his fall is greater, like his angle of fall is greater than anyone on earth, I guess, that has been measured, and you know, compared to the other sprinters. So like there's something to that, like he's able to coordinate his fall better, you know. It's at least a part of their theory. But if you think about it from that perspective, like coordinating your fall is your propulsive when you're trying to pull your foot into position, like over and over again. But you have to let go enough that you're actually going with your fall too.
Yeah.
Right. So there's always that coordination, and shit's happening real fast. So that's a constant skill to build. And you know, and I'm sure some natural ability there, just to figure out like, well, this just feels the best. You know, this makes me feel the fastest. But you know, there's a lot of things that coaches do. You know, that I'm not a sprint coach, but I would just imagine like, be able to balance those two worlds, right? But you know, if we're comparing jogging to sprinting, sprinting's going to be more propulsive. Does that make sense? Right?
Yeah, absolutely.
And even if you're just jogging faster, you would like your cueing for yourself would be, all right, I'm likely going to get more on the propulsive side of things. When I want to go longer, I have to find this flow. Like, what is the flow? Like, what is it to be able to do something longer? Well, you want to be using more momentum and less like concentric muscle effort.
Yeah.
And how do you do that in a way that's just not completely like collapsing into the ground? Well, it's often rotation and going with the movement of the guts, pretty much, like going with the internal movement.
Okay. Yeah.
And on the foot, I just like, and I've practiced this, you know, quite a bit, like with walking, and like especially during like recovery sets from any type of interval training, and you can feel how your body wants to sort of neglect different parts of the foot when you're when you're fatigued or after you've done some like real propulsive work, or just based on like the precession that we have in our body, the natural asymmetry, where you'll just want to neglect different parts of the foot, and that would tell you that you're either biasing one side or you're like neglecting that kind of full spectrum of rotation or typical motion.
Yeah,
so
absolutely.
Thinking about that now from what you know about precession or asymmetry, however you want to describe that, you think about where you might put more load on a right foot versus a left foot. Like if you just have that like kind of more traditional way of thinking about it, or traditional like PRI way of thinking, but would be you're going to be more on the outer edge of the right foot, more of the inside of the left foot. So you have to think about getting to outer left heel a little harder, maybe, and then you might actually have to really think about getting to like flattening out the right foot a little bit, and the right foot becomes a pusher. And I don't like to use that term because it's not like you're trying to like push into the ground with it, but it's just like as you're getting your body to pull and rotate to the left on that initial heel strike, then you have to be able to flatten out and pronate more on the right.
Yep.
So, because that does become like this push-pull relationship. So think about the heel being out in front of you when you make initial contact, and then you're moving from heel to like outer edge of the foot and then across to the big toe. That's sort of a pulling motion. Imagine if you created like an isometric hamstring contraction to pull your body over your foot, right? So that pulling action is happening on the left side, if that's the heel strike side, the side that's out there. And then to get you more to that side, you'll have to feel like you make sure that you get that full pronation to the other side, right? So there's always that relationship happening, and most of us have some asymmetry there, and we can assume just from what we know that it's more often on the right that you'll have that difficulty with pronation, and on the left you might have more of a difficulty with expansion and supination with that initial heel strike.
Well, so my question is like, I guess this is from a personal perspective. It's like I feel like at this point, if you go through like compensatory strategies and everything, I feel like personally, interestingly, I've almost gotten to the point where now I almost can't get to the inside of the left. Because I feel like my idea is that if femur and tibia are both rotating outwards and they're just following,
right,
then at that point it's hard to get back inside, and then that's when you, I guess, start with that early propulsive, but then work towards a mid propulsive foot eventually, I guess. Does that make sense?
I know what you're saying. You got to prioritize though. So sensation is huge when it comes to the foot connected to the rest of the body, right? So when I think about like training somebody's like foot mechanics, before I'm doing anything with manual therapy, I'm making sure that they can actually feel like references in their foot.
Yeah.
Right? Because you need to put people back into like the functional positions anyway as you start getting motion there. And as you start to ask people to be able to find these references, you can really see if like their foot just doesn't want to move, like the subtalar relative to the midfoot. You can really see that, but you just want to make sure that like you have some references that you're explaining to people. So I like to think of the four corners of the feet, two sides of the heel, two sides of the ball of the foot, and just do a lot of work with trying to make contact there, and then adding like a massage ball that has some give to it, like a pinky ball, something that you can like break down too and flatten out, is really helpful, because you're often trying to flatten people's feet when you're trying to create more pronation.
Yeah.
Right? So like more to the outer ridge of the foot is going to create more of an arch, and but that also like will narrow your foot. So doing any work that allows the foot to widen and feel like closer to like a flipper, right? Like a wider foot is going to likely be helpful for pronation. But again, you don't want it to stay there, so you don't want to be walking around like you got flippers. But like that's often helpful. So thinking about like the direction that you want to go, having the reference for maybe where you want to stay anchored. So this is how you start to separate out like a subtalar from like a midfoot. Well, like can I keep? Do I want maybe? Let's just use an example. If I want to keep like inversion in the calcaneus, can I keep a contact in the lateral calcaneus while I'm trying to move, the midfoot more towards the ground, or vice versa, right? What I was talking about before would be medial heel contact. So you're going towards calcaneal eversion, but you don't let the whole tibia move in or the whole femur move in, right? So there's this, that's relative motion or dissociation of joint action, and it's tricky in the foot because everything is small and wants to move together.
Yeah.
But I found that like balls work really well, but you need a reference of what the hell you're trying to do first, right? Like you don't want to just create pressure down there,
right?
But then the ball becomes something that is its own sort of block and feedback for where you're trying to go. The other thing that I have this issue too, and it speaks to like the bigger procession of like me having a hard time staying on the outer edge of my foot, or like basically I can find the outer heel contact on the left, but then I don't pronate as well, so I bypass like the where like the base of the fifth metatarsal is. I bypass creating pressure there, so my foot stays a little bit narrow, and then I get this sort of bunion on the pinky side.
That's exactly what I was.
And that's I think Bill did a video on that, and that's been interesting to really contemplate how there's a connection of like, okay, so it's like supination, but if you don't start to pronate, like you might just go from like outer heel to toes, right? And you don't get to like create that sort of gradual flattening out. Like you want outer heel, and then you want the outer edge of the foot, but as you're creating contact with the outer edge of the foot, you want that to be flattening the foot out, relatively. So instead of like trying to stay as if you were like purposely trying to keep your arch rigid as you ride the outer edge of your foot, you're flattening out towards, and then eventually you're going to go to the big toe and create the windlass mechanism. That would be optimal. So you're trying to go outer edge of the foot, but flattening across instead of, I remember learning this in school, it was almost like you drew a line on the outside of the foot where it was like heel outside of like the bony aspect of the fifth metatarsal or something, and then right across the ball of the foot to the big toe. That would been optimal, but like that's almost too rigid. Like that doesn't take into account the whole, like we want to broaden the foot across. You just don't want to keep falling like towards the navicular and lose too much into that plane, like because you eventually have to be able to propel through the big toe,
right?
But then I think the tricky thing about propulsion too is like we always can think of it as like the act of actually pushing off, right? And I don't think that happens that often, where it's actually more like we're falling to the other leg. So it's more of like you want to make sure you go through that whole spectrum, like that you are making that contact, but you're not actually like pushing your foot down through the ground to then push off, because then you're getting heavier, like you're moving backwards where we want to be moving forward. So that's where like the idea of gravity often comes into play, and even with something like a straight up vertical jump, right? Like you want to feel the big toes finish that movement, but it's not. You don't want to feel them like hard. You don't want to be pushing down. You want to feel like you're propelling up. So this is where the inside of the foot connects to the adductors, like all the other propulsive things up through the hips, right? So we got adduction, internal rotation. Well, those are upward movements, ascension of the pelvic diaphragm, right? Those are upward movements because you're trying to create a propulsion typically upward, right? Like gravity's trying to push you down. So propulsion is going to be moving, in some direction, but typically like against gravity.
Right. Yeah.
But with walking, because the translation is forward, it's almost like it's just this timing of shifting,
Mm-hmm.
right? And so you shouldn't feel like you're creating a lot of pressure through the inside of the foot, because like you're coming off of that to go on to another one. So again, that heel off is where you're going to have like the max propulsion, and then you're starting to go to the other leg.
Mm-hmm. And then, so I'm thinking now, pretty much if you think about procession then in terms of gait, and what you were saying about like you can get that outer heel on the left and then you feel like you miss that sort of flattening out. So then that would pretty much be like you're just going to max propulsion very early in a way.
Too early, or but let's prioritize it, right? Like if you're never getting that outer heel on the left, it's better to get the outer heel,
right?
You know what I mean? And then okay, now there's something else I got to work on. So again, like a good intervention, you can do manual therapy there. You can hold someone's like base of their fifth and try to move it more towards, I guess that would be more towards internal rotation, like of the fifth met. But I like to just actually like have it like a soft ball, stepping on a soft ball with that and trying to move it in that direction. That flattens the foot in there, and then trying to hold that position, like have that contact there of where I want my foot, and then be able to still create motion of my calcaneus, right? And so now you have like an ability to separate that out, and that's going to be stiff. So this is certainly where manual therapy can come in, because what is manual therapy other than better stabilizing points? That's really all it is. Like if you don't have the relationships in your head, though, it's not that useful. Like if you think about manual therapy as just trying to like create specific structural like stretch, or without like some connection to like a bigger functional activity, then it's not as valuable. But as soon as you say, okay, like I'm really just trying to break down gait, and I've done everything I can, and it just seems like they're not getting it without more need for contact, more need for feedback, then that's where hands come in. Right. And there's a bunch of different ways to do that. Like guided and directional isometrics work really well for that too, right? Because you're giving somebody a cue of the direction you want them to go. Well, that's ultimately what we're trying to do here. Even if you're holding something and mobilizing it and oscillating it, you're trying to give them a direction that it can't do on its own.
Yep.
Right? So you have to understand the direction, and you can think about it like the broad scale, but then you might just have to like prioritize like what does somebody need. So I think of it as like that outer heel contact will be first, often during the gait cycle for a lot of people, and just seeing side to side, like is it very different on one side versus the other. So in PRI, like impingement instability, that's a big part of the references that are used, and it's just based on gait. And you get outer heel on the left outer heel, inner part of the foot, like right arch would be their cues. But then like Bill breaks that down a lot more. Has the calcaneus versus the talus, and like I said, he does it's just a more thorough job compared to like what I got in I&I, but that doesn't mean that PRI doesn't go deeper with it. Like if you're doing an internship with some of those guys, you know what I mean?
Yeah.
But that's the way I like to think about it. It's always helpful to bring it back to gait, I think. But then when you think about like more dorsiflexion, so like that you would need during a squat, or like a rear foot elevated split squat where you're going to have that translation forward of the knee. Now you might have to start thinking about like holding heel contact longer, inner heel contact longer, while you have that shin coming forward. And I think that's a really valuable assessment, depending on where you are. Like you'll probably start with gait for a while, and just even do some things in single leg standing, supported single leg standing, and just see how like the foot responds, and just see if people have an understanding of it. But then when you look at what happens when that shin translates forward, like what happens with the foot, is there just like no motion? Like is there just a block? But you have to look at like what's happening at the foot too.
So how are you assessing if they have that motion or not? You're putting them in those single leg stance positions and basically seeing how they move.
it depends. Like I might have someone in half kneeling, right?
Yeah.
And just look at it from that perspective, like because for you, my clientele, like being in a rear foot elevated split squat, just the balance might be too much, right?
Mm-hmm.
But I might even just have somebody, being standing, holding on to something for support, and just like, all right, shift your tibia forward and see what happens there, right?
Yeah.
But I haven't done that as much. I used to do a lot more with ankle dorsiflexion, but I work more on gait now, where you don't need as much, and I just try to like really get people to own all of the foot mechanics there, more than I'm working as much on dorsiflexion. Like if I have somebody who's really, like Olympic lifting or something like that, then I'll have to, work on that kind of depth there. Just haven't had a lot of that recently. And I think when you get into athletics, you'll be able to get people into harder positions, and you'll have to start thinking along those lines a little bit more than when you have like the general population. Like just regressing gait can get you a lot of places.
Mm-hmm.
And it starts to make people understand, I think foot mechanics a little bit better. And then something like, just even like a general hinge pattern, like an early squat pattern of like where you're going on the foot, like bilaterally. So as you're expanding and getting deeper, like where do you want to feel the foot as you're coming up, and you're propelling up, and you're feeling like you're zipping your thighs up. Can you feel the inner side of the foot a little bit more? Like I think that's like a good starting point for a lot of people.
Yeah.
But when I say a lot of people, it really depends on your clientele. I think athletics, it matters more. Like with cutting and high velocity cutting, like that stuff's gonna manifest more, where you might need to be more specific.
Yeah, it's interesting thinking about dorsiflexion and plantar. Like I forget what some long-time professional basketball player, I forget who it was, but like they had him do like the FMS or something. This was like years ago, I think, and like his active dorsiflexion was pretty much negative, but it's like he could jump out of the gym.
Right.
Which I guess makes sense from like a thinking about propulsion. Like he just sort of lives in that spectrum, and then but so then how do you determine, like, I know we always talk about starting from the center out. How do you determine when you need to go? I mean, you could address it to the foot, or honestly, and I guess any extremity. But like, how do you determine when you need to go more distal in an intervention? If maybe, like, would it just be if they're not getting the full effect what you would expect from something that incorporates more proximal positioning?
Yeah, I mean, you're not trying to isolate interventions, really. So, I'll give you an example. And again, this is my clientele, so it's going to be very different from like listening to people that work with a lot of athletes. But I think it can be helpful to see how you can scale things. So, like, let's just picture like a 60-year-old woman, thin, like maybe at risk for bone density issues, narrow infrasternal angle type of idea. So I'm trying to teach like the squat from like the mid-range sticking point, like a box squat, but I'm trying to break down some of the sensation of it. So starting first, like, all right, let's just say like I just met this person, just starting the process. I want to make sure that they got respiratory mechanics. I want to make sure that they understand like inhalation is expansion, and how that then corresponds or can be superimposed on an exhale, and how the exhale helps them get up, helps them propel, helps them, then get a connection to pelvic floor and inner thigh. But you start from the center, and then I'm going to like bleed that out a little bit, right? So, okay, can you get the respiratory mechanics? Can then you also feel, as you're starting to exhale and stand, that you feel a little bit of convergence of the adductors. And so maybe I use like a block. It depends. That narrows the stance so much that it really depends on balance. But the idea is you also have an external cue of when you're standing up, not hinging too far forward, right? Like a feeling of saying, okay, I want you to propel up in as vertical a motion as possible. It can't be perfectly vertical, but getting that idea of like direction, right? Once that is pretty well understood, then I'll connect the anchor of the foot.
Yeah.
So, and then there's the down and the up, and that can be broken down into, okay, I just want you to work on like the dead start concentric.
Yeah.
Like, I don't care how you come down. You can put your hands down. But then eventually it'll become like the eccentric and the concentric. And you want to feel like, do they have the sensations up in the middle? But then can they connect the inside of the foot, like inner heel, to standing? And then when you're coming down, can you find outer heel? But it's, again, you don't want it to only be outer heel. It has to be like outer heel still with the rest of the foot in contact. So it's a subtlety there, and it's hard. It's hard for individuals to be able to do that. So I think it's better to start in the center, because you can see the improvements like starting from scratch. Like, people really start to understand that. And then when you start talking about the foot, that becomes like the next level of conversation, and that becomes tricky to be able to coordinate both. And they might be doing some version of it already, but then when you like actually bring the attention to it, it's hard to get. So you want people to have that awareness of the connection there, and they need to feel it kinesthetically, but they also just have to be told that is a relationship that exists.
Yeah.
And that might be the first start there. So that's like a specific example, just starting bilaterally, just get that to feel like more consistent, right? And it's a sensation thing at that point. All right. And then, but with gait, like starting with like slow walking, which is usually where I start people. And if they need, depends on balance, how much support do they need? But I'm going to have them make sure that they understand like the stacked position, like that I'm looking for in all of the, heel strike, stance position, rollover. I usually try those three just to simplify things and help people appreciate like that stacked position to their stride. And I start without arm rotation, without reciprocal, like upper, just the lower body, with holding on to bilateral sticks. But I'll just start with that stack position, and then I might cue, okay, when your heel comes down, can you feel the outer part of the heel? Right? And so sensation to me is a big part of where I'm starting. And then if somebody just isn't getting that over time, then I might have to like do some intervention with the foot, or before I touch them, because I don't really want to use my hands, because most of the time these people aren't in a physical therapy. At least, they're not under a prescription, and there's such a gray area there. I just try to stay hands off as much as I can. So I'll get a ball, and like just having people explore that and really understand how to use a ball, get more of a sensation to the undersurface of the foot, can really help. And then I'll put them back into like slow walking. Like, can you feel your foot a little differently there? Or just stand and feel the four corners of your foot. Like, all right, can you feel the inner heel? Can you feel the outer heel? Can you feel the inside of the ball of the foot? Like, I feel like that's really important to just start to get those patterns and those maps, right? Like coming up that sensation there. And then you start to those cues and those references are now there for them as we add more movements. Right.
Yep.
But they're going to correspond to stuff that's more central. And I think that's often a good place to start, and then connect it to the anchoring of the foot later.
Yeah. Like it always comes back to starting from the center out the way. I feel like then if you don't have the center, then you really probably can't get the full positioning or ideal positioning anyway.
Yeah, and it also matters if are you dealing with somebody who's coming in with like a pain in their ankle or foot, and if that's the case, then maybe you start working on separating out, dissociating joints in the foot quicker.
Yeah.
Right, because movements in an area that's painful can be helpful for decreasing the pain oftentimes, or that would be part of what you're looking at. So you might be more specific based on someone's complaint.
Yeah.
Like, again, I have a lot of people that are just, you could tell that their feet they need more relative motion in their feet, but they might be working on something like swings and stuff that's more hinge oriented, and they're progressing. So I'm going to give them some stuff that's, broad in general for the foot, like just to get it moving. And again, the massage ball on the foot is usually very helpful for that.
Yeah.
Or at least something that you can give someone, because it's not just like a mindless intervention. I'm saying like, oh, just take this ball and rub your foot with it. It's like having a hand. It can become like having a hand on your foot that you can direct in the direction you want. So you can use that to educate somebody without having to use your hands. So just to kind of clarify like how that's being used, I'm not just rolling the ball out and saying use that, but just trying to get them to get more out of creating motion in their foot, and then also develop a kinesthetic understanding of some of those relationships. But the progress is still being made, because the movement that they're doing doesn't require much more.
Mm-hmm.
Right?
And then you give them more independence too, because they can play with that on their own.
Exactly. And there's no pain complaint that you have to like dive deeper into.
Mm-hmm.
Pain complaints matter.
Yeah. So if it is someone who is coming to you in pain in more of a physical therapy sense, then that's when you may possibly be quicker to go hands-on. Versus if it's a training client, it's probably going to try to not do that.
Absolutely. And I think one of the major things you have to consider when somebody's in pain is how confident are you with your ability to like modify your pressure to make what you're doing to someone not threatening.
Yeah.
All right, and that's a lesson that I'm continuing to learn. Some people like do better when you do like gentle hands-on stuff early on, and some people do worse with that because they're not in as much control because you're in control. And even if you are pretty experienced with what you're doing with your hands, like you're putting yourself in a situation where if someone's just threatened by having someone else touch them, you can make them worse early on. So there's a lot of things to take into account there, and I've learned that lesson, a couple times. It's not a lesson that I can say is like cut and dry from a structured standpoint. It's like I'll never do it again because there's a lot of variables based on the person.
Yeah.
But like I want to use my hands to get a better feel for joint play and things like that. So that could be a very valuable specific assessment.
Mm-hmm.
But I don't think it's a real like reliable assessment. If you take a bunch of therapists and it's just you get a sense of what you feel over time. But it's hard to measure that broadly.
Right, that makes sense.
In a reliable way, but it shouldn't be the only thing that you take into account. But I think it certainly can be helpful, especially if you have like a body of norms of what your hands feel. But then you're connecting it to what you see when people move as well.
Right. Yeah, absolutely. That makes a lot of sense. Can't wait to learn to do some manual.
Yeah, it's cool. It's just, I think the palpation is the thing to take the most from manual therapy.
Yeah.
Not the theories of what you're actually trying to do.
Yeah.
Because the theories will change, but if you know how to put your hands on a joint, you know how to stabilize a joint, you know how to palpate different structures, and not necessarily in isolation because everything is layered, but you just generally know like what you're attempting to touch and all the things you might be in contact with in different areas. That's really valuable.
Yep.
Right, and because you can be using your hands a lot of times as just an anchor to help people separate motion. Right, like you end up giving people more control just by holding them in place and allowing them to move.
Yeah.
Yeah,
you're just to a certain point. You're just giving them more reference.
Yeah, exactly. And I think the more you think of manual therapy along those lines, the more effective you'll be with it. Right. But then you have to realize, like, people have business models that are based completely on manual therapy, right?
Yeah.
And when you have that, then you're in a situation where like those people will have to create some type of marketing theory around that to indicate that like what they're doing is sort of enough,
Yeah.
and as opposed to just being part of it. And I think there's much more collaboration now, so you kind of get this appreciation for like what manual therapy is and what it isn't. But there's still like this long-standing history of marketing to say like just touching someone with your hands is all they need, and then you have to back that up with a theory that's like, okay, I'm sublux, like something sublux, and I'm putting it back into place, and that's all they needed, right? And the theory is always going to be too simple, right? So if you just try not to get lost in theories and think of it as just like another skill that you're building, you're building a skill of using your hands as like eyes to feel the body in different ways, and that's something that always gets developed. And you're using your hands to be able to think about like how joints move and how you can stabilize one while you want to create motion at another. So if you have the internal like mind or like the image in your head of how joints move or how you want them to move, then I think hands-on stuff gets a lot easier. Right?
Yeah, absolutely.
But like learning is sort of interesting, I think, with manual therapy, where sometimes you just got to like learn the technique and practice that a lot, and that does make your palpation skills better, right?
Yeah.
Like it's you almost start to realize that what you were told about that technique isn't true just by doing the technique more.
Yeah.
Or it's more complex than that just by doing it more.
Right.
I would just stay open to whatever you hear. You're going to take a lot of value from it, but then you also probably add your own into it as you learn more models.
Absolutely. Awesome.
All right. Is that anything else on that topic? I was trying to think if there was anything. I mean, yeah, I think that's a good way to look at gait, and then you would just break down other movements and think about like where does the same idea of like propulsion and loading, where does it fit?
Yeah.
Depending on the movement that you're in.
And then you just incorporate it into your exercise selection depending on what someone needs. It's like you can just check all these boxes off from different ways.
Yeah, I kind of think of gait as like the beginning point to rotational movement. It's like the slowest movement, kind of the easiest one to break down. And then things like the golf swing or this other rotational movement that will have some similarities in how you want to load and propel. There'll be different angles at other joints. Like you can have you have a good base just by understanding gait, and then you can kind of put that into other rotational movements.
Yeah, absolutely, awesome. No, that was great and very helpful. So, unfortunately, I have to run in a second.
Yeah, no, perfect. I have to call someone too.
Cool.
So, yeah, it's worked out. Let me know if you have any more questions. If you want to text me, go over that, and then we'll be in touch this week.
Sounds good. All right, Chris.
Later.
Take care.